Generally, humans shed between 50 and 100 single hairs per day, according to the Mayo Clinic. It adds that preventing hair loss is not possible when it is due to disease, aging, heredity or physical stressors like injuries. Nonetheless, if it is due to a nutrient deficiency, you may be able to incorporate more into your diet, or take supplements. Even though hair comes in different forms and may vary between people, it is all largely made of the same materials. Indeed, for healthy hair growth, nutrients, vitamins, and minerals are essential. New Jersey Hair Restoration Center says the nutrient deficiencies that cause hair loss are varied. The site says that an iron deficiency is a very common form of nutrient deficiency and a major cause of hair loss, as iron helps red blood cells carry oxygen throughout the bloodstream. Without enough iron, the blood cells cannot deliver enough oxygen to the body, resulting in symptoms like hair loss, brittle nails, and fatigue. Hair Restoration also says that zinc is a crucial nutrient for healthy hair as it plays a vital role in cell and immune function and protein synthesis. High cholesterol, the sign in the legs that can occur at night, massive red flag. Moreover, it notes that vitamin D stimulates cell growth, boosts immunity, leads to better skin and stronger bones, and stimulates old and new hair follicles. Generally, hair loss is not usually anything to be worried about, and can happen to both men and women. Though occasionally it can be a sign of a medical condition, so if you experience sudden hair loss or you begin to develop bald patches, the NHS recommends that you consult your doctor. The GP should be able to tell you what's causing your hair loss by looking at your hair. Tell them if your hair loss is affecting your well-being, and ask what treatments are available, the site adds. B12 deficiency, the sign around the eyes that may be warning that levels are low, signs stroke, the very common vitamin deficiency doubling your risk of having a stroke, warning dementia, one drink may age the brain by 11 years when consumed more than twice daily. Insight, hair loss, known medically as alopecia, is fairly common. It's estimated, for instance, that around 40% of women aged 70 years or over experience female pattern baldness. Finasteride and minoxidil are the main treatments for male pattern baldness. Minoxidil can also be used to treat female pattern baldness. Women should not use finasteride. The Cleveland Clinic says, it is important to note that premenopausal women should not take medications for hair loss treatment without using contraception. Many drugs, including minoxidil and finasteride, are not safe for pregnant women or women who want to get pregnant. Other hair loss treatments include steroid injections and creams, as well as immunotherapy. Some people also choose to have hair transplants, which is when hair is removed from the back of the head and moved to thinning patches. Some wigs are available on the NHS, but you may have to pay unless you qualify for financial help. If your hair loss is causing you distress, your GP may be able to help you get some counseling. Repeatedly losing and regaining weight can also have an impact on your hair. The Mayo Clinic states, you might want to try various hair care methods to find one that makes you feel better about how your hair looks. For example, use styling products that add volume, color your hair, choose a hairstyle that makes a widening part less noticeable, or use wigs or extensions. Always handle your hair gently. As we grow older, there is a tendency for our hair fibers to become finer and shorter, and we may experience hair loss or graying.